The United States has one of the worst preterm birth rates in the world, and things aren't getting better for women in communities of color. Dan Grossman takes a look at what could be driving the disparity.
Tomato and avocado.
With a voice meant for the heavens,
I call them recipes from God.
Amma Chandra Brown prepares dinner in her cozy Baltimore home.
So, like, salads are pretty regular around here. What goes in it? Who knows? Who knows what's going in the salad?
But it's who she's preparing it for, her two kids, Tano and Maylee, that nourish her soul.
That's why they're my master teachers. They keep me on my toes to be present and aligned for the best.
14 years ago, Amma gave birth to Tano. Most parents, especially moms, can relate to how that moment has changed their life. But with Amma, it was different because Tano was her first child to survive.
I've had 8 babies and I have 2 living children. I absolutely am present to the gift. What it means to have them, what it means to be in agreement with them, what it means to be a mama.
Nationwide, Black mothers like Amma experience preterm births at a rate far higher than their white counterparts. Last year, the preterm birth rate in the United States dipped from 10.2% to 10.1%. But in Black mothers, it rose from 14.25% to 14.36%.
Our health and wellness is really less determined by what actually happens in the doctor's office for the most part. It's mostly determined by how we live.
Stacey Stewart is the president and CEO of March of Dimes, a leading nonprofit that works to improve health in mothers and babies. Along with other research organizations, it has found racism and discrimination are major contributing factors to these preterm births.
You see a deterioration in women's health over time, and poor birth outcomes as a result of the effects that stress coming from the effects of racism and discrimination can have on a woman's body over time.
I know I'm not alone, but it's an isolated journey.
It's something Amma experienced even with her 2 living kids. Tana was born 10 weeks early and Maylee 12 weeks early. It's why they're her miracles, as both are healthy children today.
They solidified my journey into being a well-being. And knowing that I could do this, and I have been doing it, and we're all in it together. We're a great trio.
This is a family that has lived and endured.
I am fortunate.
And holds on to what was lost, but is still loved. I'm Dan Grossman.
From cancers to rare diseases, how the pandemic is impacting crucial medical research when the race continues.